Hi, my name is Venita Chandra. I'm a vascular surgeon at Stanford. I'm the program director of our residency and fellowship training programs and the co-director of our wound care center. You are listening to Interview with the Surgeon Agent.
Hello, everyone, and thank you for joining Interview with the Surgeon. Today, we welcome Dr. Venita Chandra, Program Director of Vascular Surgery at Stanford. Doc, how are we doing today?
Doing great, thanks.
Thank you for being with us. So getting started, what were your goals and aspirations during your residency, and how did those change throughout your fellowship?
Great question. I think when you're first starting out, residency is a little bit about survival. There's a fair bit, at least I was a general surgery resident, there's a fair bit about finding my place, finding my path, figuring out what kind of surgeon I want to be, and just the basics of get through this, learn to be a surgeon, learn to be a physician, take good care of patients. So there's a lot on the plate in residency. By the time you get to fellowship, you really start to think about, okay, now this is finishing school. I've sort of started to develop who I am as a surgeon and who I am as a physician, or at least know where I want to go with that. And here's my last few years to really get myself prepared for that as best I can. At the end of the day, there's nothing like stepping out and being done. And the learning that happens after training is pretty intense. But that's, your perspective at that point is really in terms of refining and fine tuning your approach and your path as a physician and surgeon.
So as a general surgery resident, what made you want to go the vascular surgery path?
It's funny. I will tell you the honest truth was I was planning to be a pediatric surgeon for a fair bit of it. And then, quite honestly, I got pregnant and I was a pregnant surgeon and I just no longer could tolerate it. I could not be in the room. I mean, I could, but I didn't want to deal with that. And it was just a lot more difficult emotionally for me. And so everyone really sort of was shocked when I went from pediatric surgery to vascular surgery, which arguably is the exact opposite patient population. But the things that I liked about pediatric surgery, I liked about vascular surgery. You operate all over the body. It's much more reconstructive. It's creative. There's a lot of ways to do things. And actually vascular surgery suited me even more because there's a lot of sort of innovation and technology development, which is another passion and interest of mine. And you really get to take care of your patients as a doctor as well as a surgeon. So once a vascular patient, always a vascular patient, which suits some people. I really like that aspect of it.
During your fellowship, what was your mentality getting into your first job search and how that perspective changed in the beginning years of your career?
Great question. The job search process is intense. And to be completely honest, there's so many factors, right? There's your personal, sort of social, personal decisions in terms of where your family wants to be and where you want to go. And then there's the whole sort of career and academic or career, private practice, whatever it is, sort of business aspect to it. And it's pretty complex to some degree. You kind of just want to find something that lands you where you want to be. I personally really wanted to stay. Well, I should say I'm in an academic environment. My goal was to stay in an academic environment because I really wanted to be part of the cutting edge. I really wanted to be an active contributor to sort of pushing the specialty forward. But I was also, tied to the area in a way. And so, I was absolutely looking at careers and jobs that did not involve an academic focus in order to, make sure my family life was happy. So you got to look at all of the different factors and sort of weigh it all out. It is a difficult process. For obviously an academic career path, the focus is a different. You definitely have to have a vision and a plan for where you want to go in terms of the academic aspect as well as your clinical practice. I also talk to private practice programs or other types of jobs, and their focus are more on clinical skills, practice building, programmatic development aspects to it. Still really important sort of strategic view of where your career is going to go, just a bit of a different emphasis.
What would you say were some of the keys to your success that shaped your early career as you climbed the ranks in the academic world?
I think a key key aspect of climbing the ranks in the academic world is to participate, to roll up your sleeves and get in there. So opportunities that come your way, jump at them and make them work for you, make them happen, be successful at them by working really hard. I remember, and I think this is particularly an issue for women, but not necessarily isolated to women. I remember getting sort of offered and asked to give talks on the podium about topics. And, at first was sort of anxious about it. I'm not the expert. Why are they asking me? They should ask someone else, sort of thing. And the reality is that you have to take up those kind of opportunities, and you should, look at your own practice and give your opinion. That's okay. That's why they're asking you for it. And that imposter syndrome mentality is a challenging one to deal with, but an important one to battle, particularly as you sort of make your path in an academic career.
Can you briefly take us through the journey that allowed you to be the program director?
Sure. I think I have a passion for our program, probably more because I am a trainee, I'm an alumni. And so I just really, I really am thankful for what the program gave me and how I was trained. And I love that the program is, continuing to grow. And I'm just amazed by the residents and fellows that we're attracting. And so anyway, it was, a process of being starting my career in an academic environment, being involved in the educational aspect, starting primarily with the medical student aspect, and then sort of, obviously we're all involved in resident education, but with time and demonstration of interest, ultimately that led to the program director role.
So as a program director, what advice do you have for the graduating chief residents and fellows entering the professional job market for the first time?
It's a really tough time for everyone right now. It's really a crazy time. It's the job decision-making process is challenging without a global pandemic. And so I feel for all of you, just know everyone's in your shoes and the process is difficult. Ask questions. Don't be afraid of that, and ask for what you want. So be really introspective in terms of thinking about what matters to you and what matters to you most. And go and ask for those things. And I think that's probably what we have the hardest time transitioning. You've been in this sort of, middle rung, lower rung in terms of sort of the hierarchy of medical education, right? And so you just roll up your sleeves as a resident, fellow, trainee, whatever you want to, whatever your stage, and you do the work. And then you suddenly emerge and you're supposed to be able to negotiate a contract, and you're supposed to ask for all these things. And that's such a change. And we don't do a great job training you for it. And so I think, paying attention to that, thinking about it, read a book or talk to people about contract negotiation, or even just asking for what you want, because those are difficult things to do, and it's super important. And the time to do it is right there when you're looking at the jobs initially.
So as we dealt with the pandemic in 2020, now still in 2021, a lot of the national conferences have really gone online. So what advice do you have for the graduating class regarding the networking and outreaching process in the virtual world?
Yeah, it's tough. I think you have to use the connections that you have. I think it's always been pick up the phone and call someone. I mean, job, that's always been an important aspect of finding a job as well, right? So certainly the networking and places you go, but, talking to your colleagues or talking to your professors and saying, I really am looking for this kind of job. Who do you know? And having us call for you. Probably is one of the more effective ways of finding a job with or without a pandemic. So reach for that even more, I would say, in this time frame. At least for vascular surgery, I don't know exactly how it is in a lot of other specialties. The people who actually know the most in terms of up and coming opportunities and jobs and what those programs and groups really are like are the industry reps, our industry friends. And so reach out to them as well. They have huge amount of connection and huge knowledge in terms of both opportunities and what those practices look like.
So I think it's important to discuss feeder leadership in the medical and academic worlds. And obviously you being there and rising the ranks as well. What type of obstacles did you go through? What are you seeing the female population go through? And how can we potentially increase that in the medical world?
Um, good question. I think probably one of the hardest things is to, look up at the leadership the way it's traditionally been and not sort of see yourself or people like you. Right. And so it makes it a bit more, it doesn't mean you're not supportive. It doesn't mean you can't get there, but it just adds that much more, gosh, how do I get there? Or do I belong? Or that sort of aspect to it. I hope, and I think we are working hard and have a long way to go, but we hope to keep changing that and from the top down, change that, increase the amount of diversity and representation at leadership across specialties and across societies, et cetera. So with time, hopefully it will get easier. I will say that, finding or working in an environment that is supportive, finding those mentors that will push you up no matter what can really help. And I highly recommend it. I can't speak enough about how important that sort of relationships are and can impact your sort of trajectory towards leadership and help you shape who you want to be as a leader. So finding supportive colleagues and environments and continuing to push to increase diversity and inclusion across all of our societies, our professions, our administrative staff in the hospitals, at every level, we can do better, and we're making slow but steady progress, hopefully.
So on that same mindset, you going through training while being pregnant, can you kind of talk about what that was like? So a lot of times that question comes up if someone wants to start a family and then they're concerned about will that affect them in their training process?
I am so glad you asked that question. I get asked that question a lot as a female surgeon, as a program director, when I was a pregnant fellow and people looked at me like I was nuts. The biggest piece of advice I have is that don't forget to live your life. We, throw ourselves, heart and soul and body and mind and everything into our careers. And I love that about our profession. You need that, right? Because this isn't, an all-encompassing profession and it takes a lot out of us, but you cannot forget to also have your own life. And so if your own life, trajectory means, or wants to have children, you have to think about that at the time that it makes sense for your own life. And I really, really encourage people to do what feels right to them in their own life, and not wait until, well, this is done, or my residency is done, or my fellowship is done, or my, especially for things like family planning and having children. We all know that, our bodies aren't made to have children, older and older ages, and we're already older and older. And so if it works for you and your family, do it. Don't be afraid. Just do it. It will be hard, but so is residency on its own. So just live your life is my biggest piece of advice.
We hope you enjoyed this episode of Interview with the Surgeon. Until next time, stay focused and keep following your dreams.